for us, and they had a luncheon for you, and I sort of stumbled over to your facility. You have two facilities, and I went to the wrong facility, and that's how I got to meet Amy, and I saw your what you had going on over there. Really nice place, and I wanted you to share a little bit with us what you do at the Orthopedic Center. I mean, it was tremendous, that place.
Absolutely. So a little bit about myself. I'm a South Florida native. I was born in Fort Lauderdale, lived most of my life in South Florida, and went to college at Vanderbilt University in Tennessee, medical school at University of Miami, and then I went to New York City for my orthopedic training. I did my residency at the NYU Hospital for Joint Diseases, and I stayed on for my fellowship at the NYU for Hospital for Joint Diseases. I did a fellowship in hand and upper extremity surgery, so I specialize in doing hand to shoulder surgery. And my group, to tell you a little bit more about my group, we have about 11 doctors now, and we cover pretty much the whole body in terms of the orthopedic world. We have a spine doctor, we have a pain management doctor, a rehab doctor, a couple of foot and ankle doctors, and sports medicine surgeon, Dr. Matarazzo, and another hand specialist, Dr. Marvin Cohen, and Dr. Jeffrey Rosenfield as well. So we have a pretty good group, and
big list of doctors.
Absolutely.
The facility that I went to, how long has it been open? And you're also related to St. Mary's? No, you're JFK?
Yeah, so
JFK, right?
So our main office is in Lake Worth, and we're adjacent to JFK Hospital. And our other office in Boynton Beach is close to two of the other hospitals I go to, the two Bethesda hospitals, Bethesda East and West, both in Boynton.
I see. And then the other facility that you have, the second one, is located where again? You have two, right? You have one in West Palm, and the other one is further south?
No, Lake Worth.
Oh, Lake Worth
is our main office, and the other one is Boynton Beach.
That's right. That's where we had the luncheon, correct? Lake Worth? Ah, right. I'm getting my bearings. Some of the unique stuff that separates you from other centers, because I mean, it's a business now. Doctors are competing off for patients and giving them services. Some of the new things, some of the technologies that you're using in your field, new stuff. Can you elaborate a little bit with us to let us know some of the things that are going on with the center that makes it that much appealing? Because when I went there, you guys had standing room only. I mean, it was unbelievable, the amount of people that were in there.
Yeah, absolutely. So, as far as the type of work I do, from the hand to the shoulder, some of the kind of cutting edge things that we do offer endoscopic carpal tunnel surgery, which is a little more minimally invasive type of surgery that tends to get patients back to their daily activities a little bit faster. We do joint replacements of the hand, the wrist, the elbow, the shoulder. Shoulder replacements have really come a long ways in the past decade, and there's been a lot of increase in the technology and improvement in the implants that patients actually do pretty well after these shoulder replacements these days. So it's definitely an up-and-coming thing. Arthroscopic surgery of the shoulder, the wrist. There's lots of new techniques that have been coming out the past 10, 12 years or so as well.
Yeah, I saw also in the sports world a lot of athletes that are coming back so quickly. They go in and they get scoped, something gets looked at, and especially in the football and basketball fields, and the next thing you know, they're back on the field, which is an amazing thing, something that took 6 months to heal. I mean, how is it that it's done now that you can get back on your feet so quickly?
So it's absolutely true. I mean, arthroscopic surgery in general is a more minimally invasive type of surgery that causes less trauma to the soft tissues, and patients often can get back a lot faster than with older techniques where you had to have a bigger incision, bigger dissection, etc. And part of this with the athletes is that they have an incentive to get back faster. They're making the millions of dollars a year. They don't want the younger guy sitting on the bench behind them to take their spot too.
My brother had on his knees, and he was back in a week.
You don't want to lose your spot, so you get healthy real quick.
He's not an athlete, but he was walking around and back to normal within a week. And my mother-in-law, she had her shoulder done, But she's an older lady, so she had a lot of physical therapy to get back.
Correct. So I guess the techniques, and if you're in better shape, I guess you bounce back quicker.
That's
but
true.
I just noticed that, I don't know, maybe it's my imagination, but people that are having operations done on their legs and knees and ankles and things, they're coming back faster, going back to work because you don't want to lose your job, with insurance being what it is. But it seems like people are healing quicker. Now, is this part of the technique? Is it part of people being in better shape? Is it a combination?
I think all of these things that you touched on play a role for sure. With more time, we're getting better at learning new techniques that cause less trauma and are stronger in terms of fixating the ligaments and the tendons. That people are, able to get back to things a little faster. But everybody works out these days. People are more health conscious. There's a lot of factors going on, but certainly, a lot of the new surgical techniques have aided in this as well.
Now, I usually like to ask doctors when they come on the show for the first time, because we talk a lot about innovative stuff that's coming along, and people have their own idea of what they like to see. If you had an opportunity to change the game, the industry, and whatever you say goes, what would you like to see? What would you like to be either elaborated on or enhanced on, so that there's certain procedures that you do, certain things that you do should be copied throughout the industry? The one thing that you can touch on and say, I wish we did this more, or I wish I saw that more, I wish I could change this. What would it be? The one thing that you definitely would love to see more of?
Well, that's a very good question, but one thing that comes to mind would be, if we could find a cure for arthritis, or, a permanent cure aside from just replacing joints with artificial parts, because they can wear out with time. They do last a lot longer than they used to, but it would really change the way we do things if somehow we had a cure for arthritis, or a treatment, a biological cure.
What is arthritis? What is the medical definition of arthritis? Because I always hear osteoarthritis, rheumatoid arthritis. What is it, and what is the difference between the two?
Good question. So there are several different forms of arthritis. By far the most common is osteoarthritis, and you can think of it as a wear and tear of the joint surfaces. So all the joints of the body are covered with cartilage, very smooth, slippery surface without much friction, and with wear and tear over time, the cartilage can get damaged, and as it progresses, you lose that nice, smooth, painless motion between the two bones, and it can become very painful.
And why does the joint swell, let's say, with osteoarthritis?
The joints swell because of a few reasons. So there's a joint capsule that produces synovial fluid, we call it, basically a lubricating fluid. And when you have arthritis, the tissue that makes this fluid, it gets inflamed and produces excessive fluid. So that's why you get excessive fluid buildup. And then, when you get bone spurs from the arthritis setting in, that also gives the joint an enlarged appearance. Those are two of the main factors for the appearance of the joint being enlarged.
And it usually comes because it's worn down.
When I go to my yoga class, they always say, we're lubricating our joints. Do they really mean that we're lubricating our joints and preventing arthritis?
That I couldn't tell you if that's scientifically, sound knowledge or not, but definitely, keeping active, keeping the joints healthy, moving as much as possible, doing a lot of exercise, keeping the muscles around the joints strong as possible. All these factors improve, our general health, and probably support our joint health too.
And what is rheumatoid arthritis? Because is that an autoimmune disease?
It is an autoimmune disease. It's a genetic problem where the lining of the joint that we were talking about becomes very inflamed and produces chemicals that actually degrade the cartilage a lot faster than it normally should. And there's a lot of great medications that have really changed the face of how we treat rheumatoid arthritis that we actually don't do operations on patients with rheumatoid arthritis nearly as often as people used to a couple decades ago.
It's interesting. I had a friend, she's a doctor, and she thought she had rheumatoid arthritis, and she found out it was lupus. Is that something that you see a lot, that misdiagnosis?
Sure, absolutely. Both of these fall into the category of an inflammatory type of arthritis. So there's osteoarthritis, which is a very common wear and tear type that we get as we age, and then there's more inflammatory ones which have more genetic influence. And lupus, rheumatoid arthritis, psoriatic arthritis, these sorts of things all fall into that inflammatory arthritis type of category.
Excellent. And Dr. Cohen, if people wanted to reach out and visit your office to get looked at or have a consultation, what number could they reach you at?
So our main number is 561 area code 967-6500. We have a website that has all of our profiles of all the doctors you can get to know. It's www.ocpbc.com. Like I said, we have an office in Lake Worth and Boynton Beach, and we have doctors that cover the whole realm of expertise in orthopedics.
Yeah, nice place. Been there. Well, I want to thank you for coming on the air and sharing some information. I want to thank Linda for having her company invite you down. And we'd like to invite you back. What I wanted to do was ask Amy if we can go up there and take some pictures and things of your facility, because I know you have a lot of doctors up there and everybody wants to jump in here. And I'd like to roll some film or pictures, not with people, just of the facility itself, just to show them really how comfortable it is, because I think that's really important to go and see a doctor.
You know, and also I think people have the misconception that only the good doctors are in New York and places like that. We need to say that Florida has some good doctors and good facilities.
I agree. And that's an important message to send out there. But I want to thank you for coming down. I appreciate you coming. And thank Amy, thank Linda for having you. I know it was not easy getting you here because you're very busy, but I appreciate you coming here.
Thanks for having me. This was great, and happy to come back anytime.
No problem. All right, let's take a break, and then we'll